Health Forward Foundation, Capacity, Grant Application, Essential Families, Economic Mobility Program, $100,000 Capacity Building Grant Request. 1. How does your current work align with Health Forward's purposes or strategies? Describe your proposed activities, advance the goals of this purpose area. Essential Families Economic Mobility Program advances Health Forward's power purpose area by strengthening community-based organizations and redistributing power to communities of color experiencing health inequities. We've served 665 households and are on track for 851 by November 15, 2025, through City of Kansas City Digital Equity Office and Health Forward funding, serving predominantly Black, 68%, Latino, 18%, and immigrant refugee, 8%, families across urban and rural communities. This $100,000 capacity grant advances Multilingual AI Meeting Intelligence with no-W video real-time translation, $35,000, deploying AI-powered real-time translation in Spanish, Swahili, and Arabic, while establishing subscription-based services, starter $39 per month, professional $99 per month, enterprise $199 per month, extending technology to 34 community partners. Grantor, donor, digital case manager, and client real-time impact dashboard, $40,000, displaying community ROI via Urban Institute's Upward Mobility Framework, with 24 predictors showing 4.88 to 1 social return on investment. New Year's Gala fundraiser, $25,000, establishing sustainable donor revenue while creating collaborative fundraising benefiting our partner ecosystem. These activities strengthen organizational effectiveness, fiscal capacity, and regional collaboration. Health Forward's core outcomes. 2. How will this project increase your organization's strength, fiscal capacity, or leadership effectiveness? Include how projects might strengthen collaborations, networks, or partnership in your region. This project transforms Essential Families' infrastructure while positioning us as backbone organization for Kansas City's economic mobility ecosystem. Enhanced operational efficiency. No-W video AI integration automates meeting documentation with real-time translation, reducing administrative burden by 12 hours weekly per manager, and eliminating $8,000 annual interpretation costs. As we scale to 851 households serving urban and rural communities, automated documentation maintains service quality without proportional staff increases. This extends to 34 partners, including Full Employment Council, Habitat for Humanity, KC, Samuel U. Rogers Health Center, and Legal Aid of Western Missouri. Supporting digital case managers through 3-month engagement. The Capacity Grant strengthens our digital case manager model, where case managers maintain continuous relationships with families for 3 months. This extended engagement enables families to navigate complex systems spanning workforce development, housing, healthcare, and education across our 34 partner network. No-W Video Multilingual AI, $35,000, enables digital case managers working with non-English speaking families, 42% of households, to provide real-time translated support throughout the 3-month relationship. Case managers can conduct intake, coaching, and follow-up in Spanish, Swahili, and Arabic without delays, critical for time-sensitive crises like evictions or job loss. Real-time impact dashboard, $40,000, allows case managers to monitor family progress against 24 Urban Institute predictors throughout the 3-month relationship. Case managers can identify when families fall behind on mobility indicators and immediately adjust strategies or activate partner referrals, ensuring maximum impact. New Year's Eve Gala, $25,000, generates sustainable revenue, enabling continued case manager staffing. The Participant-Directed Fund, $5,000 net proceeds allocated by Family Advisory Council, provides case managers flexible emergency assistance for immediate barriers like car repairs or GED fees. Strengthened fiscal capacity. Current January-October 2025 revenue demonstrates balanced but grant-dependent composition. Grants contracts $663,305, 87.7%. Donations $83,559.58, 11%. Carry AI agent income $5,643, 0.7%. T-Mobile income $3,920,000, 0.5%, totaling $756,427.58. Transformative revenue model. No-W video translation subscription establishes recurring revenue tapping, $5.2 billion global real-time video translation market growing at 11.5% annually. Conservative projections with 50 organizations subscribing generate $5,550 monthly revenue, $66,600 annually. Scaling to 200 subscribers within 24 months projects $266,400 annual recurring revenue, reducing grant dependency to 71% while providing unrestricted funding for innovation and advocacy. Network capacity building. Offering dashboard access and multilingual technology to 34 partners elevates collective regional capacity and enables network-level outcome presentation for collaborative funding. This positions our ecosystem for multi-million-dollar regional grants requiring sophisticated collaborative infrastructure. 3. Describe the capacity strengthening or resilience activities you are proposing. Describe why activities are important for your organization at this time. Include how you use to implement these activities. Essential Families proposes 3 interconnected activities addressing capacity gaps as we scale from 665 to 851 households by November 15, 2025. Activity 1. Multilingual AI Meeting Intelligence with No-W Video Translation Service, $35,000. Implementation, deploy No-W video platform, providing real-time translation in Spanish, Swahili, and Arabic, with live transcription, automated action items, and searchable archives. Establish subscription infrastructure with 3 tiers. Starter, $39 per month, 10 users, 25 hours monthly. Professional, $99 per month, 25 users, 25 hours monthly. 100 hours monthly. Enterprise, $199 per month. Unlimited users, 250 plus hours monthly. Timeline, months 1 to 2 platform integration and staff training, 3 to 4 internal pilot, 5 to 6 organizational rollout, 7 to 9 subscription launch and partner enrollment, 10 to 12 optimization. Why critical? 42% of our 665 families are non-English speakers, requiring interpretation. Current manual documentation delays resource connections 3 to 5 days. Families facing housing instability cannot wait. Automated real-time translation enables same-day multilingual action plans while preserving institutional knowledge as 3 key staff approach retirement. The global video translation market reached $1.7 billion in 2024, projected to grow to $4.5 billion by 2025-2033, 11.5% CAGR. This growth reflects demand from remote work, multilingual education, and healthcare, precisely the communities Essential Families serves. Essential Families has invested $18,280 year-to-date in No-W video infrastructure. This capacity grant enables optimization, comprehensive training, and revenue-generating subscription infrastructure, transforming cost into income-producing asset. Revenue projections. Year 1, 50 subscribers, $66,600. Year 2, 125 subscribers. Subscribers, $166,500. Year 3, 200 subscribers, $266,400 annually. Success metrics: 95% meeting documentation completion, 24-hour action item turnaround, 85% non-English client satisfaction, 30% staff time reduction. 50 subscription customers within 12 months, generating $66,600 annual revenue. 500 multilingual meetings documented annually. 90% subscription retention rate. Activity 2, Grantor-Donor, Digital Case Manager, and Client Real-Time Impact Dashboard, $40,000. Implementation, develop web portal displaying community ROI via Urban Institute's framework with 24 predictors across 5 mobility pillars, disaggregating outcomes by urban/rural geography alongside race/ethnicity/zip code. Features, live social return on investment calculations, a holistic measure aligned with the Urban Institute's upward mobility framework to evaluate how programs improve dignity, belonging, economic success, and racial equity. This framework uses mobility metrics to track progress across 24 predictors within 5 pillars, including rewarding work, high-quality education, inclusive neighborhoods, healthcare access, and just governance. Disaggregated outcomes showing urban-rural disparities, employment/wage/education/housing metrics, and aggregated network impact. Timeline, months 1 to 3 data infrastructure and KPI alignment, 4 to 5 partner integration protocols, 6 to 8 development and testing, 9 soft launch with major funders, 10 partner training, 11 to 12 public launch. Why critical? Major funders demand real-time transparency, social return on investment calculations. A holistic measure aligned with the Urban Institute's upward mobility framework to evaluate how programs improve dignity, belonging, economic success, and racial equity. This framework uses mobility metrics to track progress across 24 predictors within 5 pillars, including rewarding work, high-quality education, inclusive neighborhoods, healthcare access, and just governance, and evidence-based frameworks. Our growth trajectory, 665 households, expanding to 851, demonstrates capacity to scale impact. Transparent measurement secures funding for expansion. Regional funders prioritize collaborative models, demonstrating collective impact. Our dashboard enables network-level presentation, positioning us for multi-million-dollar collaborative grants, requiring cross-sector partnerships with shared evaluation frameworks. Publicly reporting disaggregated outcomes showing racial and urban-rural disparities provides advocacy evidence for policy addressing structural barriers that programs alone cannot solve. Success metrics: 100% major funder dashboard access within 6 months, 40% funding application increase, 3 new foundation relationships, 15 partners and data sharing agreements, 2 collaborative grant proposals, presentations at Mid-America Regional Council, local media feature on economic equity data transparency. Activity 3, New Year's Gala fundraiser, $25,000. Implementation, host 350-person gala at Unity Village R.D. Goppert Event Center, a rural location symbolizing urban-rural collaboration, featuring family economic mobility stories and 34 partner impact visualization. Budget, $12,000, venue, show catering, $5,000 production, AV, $4,000 invitations, marketing, $4,000 staff coordination. Revenue target, $75,000 gross, $40,000 corporate sponsorships, $25,000 ticket sales, $10,000 silent auction, net $50,000 for program expansion. Timeline, months 1 to 3 sponsorship cultivation, 4 to 6 ticket sales, 7 to 8 logistics coordination, 9 event execution, 10 to 12 donor stewardship. Why critical? Current revenue shows 87.7% reliance on grants/contracts, $663,305, limiting scalability. Combined, no W video subscriptions, $66,600 projected year 1, and Gala net revenue, $50,000, reduce grant dependency from 87.7% to approximately 76%, substantially strengthening fiscal resilience. The Gala establishes sustainable annual donor cultivation, providing unrestricted funding for innovation and advocacy that government contracts prohibit. Timing leverages recent milestones, rapid household expansion, formalized partnerships with Kansas City Public Schools and Full Employment Council, and Urban Institute recognition as Upward Mobility Framework Early Adopter. Success metrics: 350 attendees, including 75 new donor prospects, $50,000 net revenue, 10 corporate sponsorships, 25 new monthly donors, 3 major donor relationships, 5,000 social media impact video views, 2026 Gala Planning Committee formed within 60 days. 4. How will you involve the community in planning, implementation, and/or evaluation? Describe how your project or organization will share power or decision-making with the communities you serve. Tell us how this project specifically benefits communities of color and/or rural populations. Essential Families embeds power sharing throughout governance, program design, and evaluation, recognizing families experiencing economic barriers possess expertise about solutions. Community governance structure. Essential Families. Board exemplifies diverse, community-centered leadership. Dr. Susan B. Wilson, Ph.D., MBA, President, licensed clinical psychologist with 20-plus years mental health and diversity experience, formerly Associate Dean for Diversity at UMKC School of Medicine. Dr. Steve McClure, Ph.D., Vice President, 45-plus years with Kansas City Urban and Rural District Schools, provided research for Missouri Charter School Law Revision, 2005. Holly Wilms, B.S., CFLE, Secretary, 25-plus years early childhood education, Director of Child Care for Kearney School District serving rural communities. Nelko Malyanov, MBA, CPA, CMA, CFO, decade-plus experience as CFO, leading financial stability and growth. Lori Elam, Democratic Director of Kansas City Election Board, 11-year career spanning voter services to finance across urban-rural precincts. Nicole Jones, M.Ed., 20-plus years early education, early childhood specialist for Head Start Region 11, with AIN programs serving rural tribal communities. Alicia Smith, LMSW, trauma-sensitive school clinician with Kansas City Public Schools. Leo Prieto, 15-plus years as community organizer and lawyer, executive director of Linwood YMCA. Doris Grant, LPN, 30-plus years healthcare, outreach health coordinator for Black Healthcare Coalition. Jim Nunnally, Kansas City icon, longtime Generation Rap radio host mentoring thousands, founded Jackson County Combat. Kent DeSell, principal business consultant at Due Process International, LLC, established Essential Families, Midwest Incorporated. Participatory planning. Multilingual AI and translation service. September 2026 focus groups with 35 Spanish-speaking, 18 Swahili-speaking, and 12 Arabic-speaking families from urban and rural communities assessed communication barriers and co-designed translation solutions. Participants tested No-W video, providing feedback shaping language priorities and meeting summary formats. Leadership from 8 partners serving immigrant communities participated in service design, ensuring technology meets needs across organizational contexts and geographic dispersal. Subscription pricing was structured based on partner feedback, ensuring affordability. Grantor, donor, digital case manager, and client real-time impact dashboard. April to June 2026. Design sessions with 47 participants from urban and rural communities identified what economic mobility success means. Participants prioritized dignity from employers, manageable schedules, and wages sufficient for family activities, not just survival. Dashboard prominently features participant-authored stories, ensuring community voices communicate impact authentically. We extended participatory design to 34 partners through 5 network convenings where staff and clients identified shared outcome indicators and data sharing protocols. Fundraising Gala. Family Advisory Council representing urban and rural households selected event theme, Building Our Future Together, reviewed sponsor recognition, and designated $5,000 net proceeds for participant-directed emergency assistance. 4 council members serve on Gala Planning Committee with decision-making authority. 3 participants will share economic mobility stories, receiving $500 honorariums and professional storytelling coaching. Shared decision-making. Essential Families operates a participant-directed fund, $25,000 annually, where Family Advisory Council votes on emergency assistance requests outside traditional guidelines. Recent approvals included car repair, GED exam fees, and professional clothing. This demonstrates trust in participants' judgment, redistributing power over resource allocation. Evaluation and continuous improvement. Our Urban Institute evaluation disaggregates all 24 predictors by race, ethnicity, language, zip code, and urban-rural geography, ensuring we're closing equity gaps. Quarterly, we share disaggregated data with Family Advisory Council asking, are we serving all communities equally well? Where are disparities emerging? For instance, 2024 data revealed lower housing stability for Black families and rural residents. Council members identified discriminatory landlord practices and limited rural housing stock. Essential Families subsequently launched landlord education and partnered with Legal Aid of Western Missouri for tenant rights legal support, eliminating outcome disparity within 8 months. Benefits to communities of color and rural populations. This project specifically addresses systemic barriers facing Kansas City's Black and Latino communities and rural populations. Economic justice. Dashboard's transparent tracking holds Essential Families and 34 partners accountable to equitable results across racial demographics and urban-rural geographies. Real-time disaggregated data enables immediate intervention when disparities emerge. Making this data publicly accessible creates advocacy evidence for policy changes addressing structural barriers that programs alone cannot solve. Linguistic access and digital equity. Kansas City's growing immigrant communities face language barriers, preventing access to economic mobility services. No-W video real-time translation ensures families receive critical information in primary language without delays. This is particularly critical as rural partners lack interpretation budgets. Subscription-based technology democratizes language services while generating revenue sustainability. Geographic equity and rural access. Rural communities face unique barriers, including transportation deserts, limited broadband, healthcare shortages, and concentrated poverty. No-W video enables virtual service delivery, reducing transportation barriers. Dashboard's urban-rural disaggregation makes visible disparities often hidden in aggregate data, enabling targeted interventions. Cultural responsiveness, centering communities of color and rural populations in dashboard design, translation development, and Gala planning ensures services reflect cultural values and lived realities. Participants emphasized extended family financial interdependence as legitimate mobility indicator. Our dashboard now tracks multi-generational household economic stability. Wealth building and asset development. Gala proceeds and No-W video subscription revenue, enabling expansion beyond current 665 households, directly benefit Black, Latino, and rural families experiencing greatest economic barriers. By strengthening our 34 partner networks' collective capacity, we multiply impact across organizations serving communities of color and rural populations throughout Kansas City region. Power redistribution and leadership development. The project builds leadership capacity within communities of color and rural populations through Family Advisory Council participation, paid participant roles on Gala Planning Committee, and storytelling platforms positioning participants as policy experts rather than passive charity recipients. Essential Families' power-sharing approach recognizes those experiencing economic injustice are experts in solutions, not passive service recipients. This project strengthens our capacity to embed authentic community voice throughout organizational operations and across our 34 partner network, advancing Health Forward's vision of redistributing power to people of color and rural populations historically excluded from decision-making. All required changes are applied, Every section is retained and reformulated to reflect the full social return on investment definition from the Urban Institute's Upward Mobility Framework and Mobility Metrics Initiative.